Hi, I'm Dr. Ketan Badani. I'm the director of the Comprehensive Kidney Cancer Center here at Mount Sinai. I'm going to talk a little bit about the research programs we have in place for kidney cancer. There are two aspects of kidney cancer that I think are unanswered, and they're both at the opposite ends of the spectrum. On one end, we have the very early diagnosed kidney cancers, small renal masses, and many of them can be watched safely, or some of them are even benign, right? We don't even know that they're cancer. And what do we do with that? Do we continue to follow it? Do we treat it aggressively? How do we better define these early tumors? And then the other unanswered question in kidney cancer is in advanced disease, in patients who have high-risk kidney cancer. It still is one of the most lethal urologic cancers because metastatic kidney cancer is a bad situation. And so what's the optimal treatment for the other end of the spectrum? So our program is trying to answer both of these questions. On the early side, we have a phenomenal relationship with radiology and Dr. Sarah Lewis, Octavia Bain, and Bashir Taouli, who are looking at radiomics and MRI and correlating it with the pathology that happens when we treat these kidney cancers in surgery. And then we can correlate the radiomic signature with what's in the tissue and the tumor itself. And then we work with the Tisch Cancer Institute with Dr. Amir Horowitz's lab to look at the tumor microenvironment, the natural killer cells and the immune profiling of these tumors. And we should be able to figure out a signature that the radiology imaging, the MRI, can capture and define. Is this a benign tumor? Is this an aggressive tumor? Is it cancer or not? And then the next step for that, which we just have some very preliminary data, is actually creating a biomarker test. And so we have some wonderful preliminary data looking at a urinary biomarker. We look at a few proteins in the urine that might be able to distinguish clear cell renal cell carcinoma from other tumors. So that's what we're doing on the early side. On the late side, we have a great pipeline set up where we're able to grow organoids with Dr. Ben Hopkins' lab in the Tisch Cancer Institute and take the tissue from kidney cancer patients after their operation, grow the organoids, basically, test hundreds of different drugs against that patient's particular tumor to see which is the most effective. Kidney cancer does grow very well in the organoid model, and someone who has the expertise of Dr. Hopkins knows, because he's doing it in a lot of other tumor types, but we've had very good success with kidney cancer. And so hopefully that will help answer a very important question, which is personalized or individualized medicine for those with advanced disease.